Hodgkin lymphoma is one of the most curable malignancies. Unfortunately, we have some patients who are primary refractory to first-line therapy and patients that relapse after attaining a complete remission. These patients are being treated with an autologous stem cell transplant, but autologous stem cell transplant is only a curative therapy for 50% of these patients who are candidates for transplantation. So we need new drugs and new treatment strategies for these patients. The advent of Brentuximab vedotin, which is monoclonal antibody drug conjugated, has been able to fill in some of these gaps in clinical care of these patients. And Brentuximab vedotin is basically approved for those patients with Hodgkin lymphoma that relapse after an autologous stem cell transplant, and as a single drug is able to give a 34% PET negative complete remission with a small proportion of patients that can eventually be cured after receiving Brentuximab vedotin. Brentuximab vedotin is also approved for those patients that have failed 2 lines of chemotherapy and that are not considered stem cell transplantation candidates. And in this situation, BV is also able to give a significant proportion of overall response rate and complete remission rate, and is able to bridge almost 50% of these patients to a potential autologous stem cell transplantation. And the other indication for Brentuximab vedotin in this subset of patients is to consolidate patients that are candidates for an autologous stem cell transplant, and they have a high risk of relapse after the autologous stem cell transplantation. The benefit of Brentuximab vedotin consolidation in this setting was demonstrated with the AETHERA trial, which is a phase 3 randomized prospective clinical trial, and consolidation with Brentuximab vedotin in the way that it was administered in the AETHERA trial was able to significantly improve progression-free survival after autologous stem cell transplantation of these high-risk patients.